you so much. Are we ready now? Okay. So, it is 3:01 p.m. on September 13, 2021, and we are here for a special meeting of the Sioux City Community Schools Board of Directors. We're going to begin by reciting the Pledge of Allegiance. Could you please stand up? Much. Cindy, could you please call the roll?
Mrs. Alarcon-Fleury.
Present.
Dr. Albert.
Yes.
Mr. Goodman.
Here.
Mr. Greenwell.
Yes.
Mr. Saint.
Here.
Ms. Scarlett.
Here. Very well. Directors, you have in front of you the published agenda for today's special meeting. Is there a motion to approve this agenda?
So moved.
Second. All those in favor of approving this agenda signify by
Can
saying.
we have some discussion?
Okay, yes?
I received the agenda, and on Monday night, I thought we were just considering a mask mandate. Can you explain to me what and COVID mitigation measures means? Because I don't know what we discussed on Monday night about that. So if you can explain that. I understand the mandating the mask, but I don't know what and COVID mitigation measures mean.
We are also going to visit on some of the things that the district is doing in order to prevent or mitigate any COVID spread. What are the investments? What are we keeping an eye on? How do we know? Stuff like that. Just to give us a little more room to discuss other items.
Could this include a dashboard so that folks could see the numbers?
Yes, it could.
And just remind me, the numbers again, I think is there an update on the number of positive cases?
Well, we
last
have,
meeting?
on the website, we have been displaying the numbers of cases that have been reported to us. But you need to remember, this is reported by the families or by the parents. This is nothing that we get from the health department or doctor's offices or anybody else. This is just self-reporting.
Great. Is there any update since Monday night, or is the website the most current information?
Dr. Burianic, I defer to you.
Can I interrupt for one moment? We're getting several messages that they cannot hear
Okay.
on live stream.
Can't hear anything or can't hear the
It
telephone?
said no sound on the live stream.
I'm pretty sure it's coming through because it was interrupting us back there, so. I can go check back.
Okay.
Okay, thank you. Are those from people in the other room or are those from people at home?
These are citizens that are texting. And actually our superintendent.
Oh,
It is working.
And the Teams is working? Dr. Gosman?
Live stream is different than the Teams.
Okay, Dr. Gosman said he doesn't see the Teams.
All right, he's up there now.
I saw him earlier. Dr. Guzman, can you hear us? Yes, okay, good enough.
It is working now. Yes, it's working now. Thank you.
Okay, perfect. Thank you so much. Thank you, I appreciate that. I'm sorry. Very well, we have in front of us then this agenda. Is there any other questions for members?
Yes, I do have discussion that I do agree with Mr. Greenwell that we were supposed to be considering the vote today of the mask mandate. I was not aware as another board member that COVID mitigation measures would be discussed.
Okay. We are going to discuss that. The discussion on COVID mitigation efforts came from the emails and information that parents and community were requesting from us.
Okay.
So in order for them to also talk about it, we needed to open a little bit more so they could also talk about all those other things.
I appreciate that, but board members are supposed to be informed, is that correct?
The agenda was sent yesterday.
Okay, of any changes, but it said that those were the changes of the original agenda.
There was an email, an exchange of emails. You were included in the email saying I had updated something.
Were the other board members informed of that, of the changes of the agenda? So it was something that was put in there without the board actually knowing that there was going to be a change on the agenda?
I didn't send an email to every board member, no.
Okay.
No, I didn't mean it like that. There was an exchange of emails between our board secretary and the vice president with this information. And the packet went out yesterday to all of the board members and the community.
Sure, but the discussion, I guess what I'm trying to find out, if we're just going to describe what we're currently doing and what board members have been familiar with and been disclosed to board members previously, I don't have any difficulty. If you're talking about new things you're going to propose, and you're going to be talking about today, then I have concern about that.
No, we don't.
If it's just communicating what we're already doing and what we plan to do, I have no issues with that. But if it's about new stuff, then it's problematic.
We're communicating what we're doing. If we were only going to talk about masks, I felt it was really limited to just talking about masks. And so we're communicating the practices that we're following right now. And that was the only reason why the title was extended a little more.
That's what we're going to do.
So that's for informational purposes only, not in consideration of what the board has already moved to do today?
Well, I mean, I guess I would say, I mean, as that's noticed, I mean, we're legally able to talk about any COVID mitigation measures because of the way that's noticed. But I do think we need to be clear with the public as they come forward with their comments so that they can know, the scope of what we're talking about.
Speak into his mic a little bit more.
Sure.
I can't really hear him.
Yeah, I'll get closer to the mic, Dan. So that if we just need to make sure we're being clear with the public on, what they should be speaking on. Are we limiting our discussion to masks or other things such as social distancing, limiting the number of people at events, that sort of things like we did last year? Are those on the table as well?
We are going to talk and explain to the public the things that we're already doing. That is the purpose. And then what is on the motion is the consideration of a mask mandate. But make it clear to the public as part of the conversation what is being done already or what are we doing already.
So this would fall under our reports on our regular board meeting that we talked about on Monday? Or now implementing what I requested in the beginning of the school year of having a full report?
This is a special meeting just for this purpose. We are not talking about the regular meetings right now.
I understand that, but what I'm saying is that we decided and approved something to happen today. Now we have addition to, without all of the board's knowledge. And so are we going to, that information is for informational purposes only. And so the public has to understand, just as Director Saint said, it's for informational purposes only. Is this the information that we've asked for since the beginning of the school year that is now going to be presented today, like data of how many cases, what the district is doing to prevent, supplies, things like that? I just want to know what we plan on doing in the additional information that all the board members were not aware of.
Right now,
I agree with you, Director Scarlett. That's exactly what my thoughts are as well.
right now we're just explaining to the public the things that we are doing right now for a better understanding. The vote itself is going to be about, and yes, we're talking numbers and we're talking resources and we're talking of what we have right now. The vote itself is going to be on that recommendation that you see on your agenda, the recommendation of mask mandates. That is what we are considering, and mitigation measures again is for discussion, is for explanation only, for just to let the public know what we're doing on that.
Well, that's my question.
Then I would change the recommendation is, if you're saying the recommendation considers mandating masks, period, COVID mitigation measures will also be presented. I mean, I would think that. Because if you said our only vote was on masks, I think that's it. But if this says and COVID mitigation measures, I don't know that we're voting mitigation measures up or down.
We are not voting mitigation measures, no.
I would recommend changing that recommendation that the board of directors considers mandating masks, period, and discussing current COVID mitigation procedures. That's a separate thing. But
Is that
I don't think we're recommending COVID mitigation measures in this vote today.
Is that an amendment you want to make to the agenda or correction
That
of
is an
sorts?
amendment, yes.
Okay.
That is-
Is that a motion?
Yes, I would make a motion that the recommendation be limited to that the Board of Directors considers mandating masks, period.
Okay?
Second.
For clarification purposes, even we're only going to decide on masks, we can still talk about the preventive measures that we have in place. Maureen?
Sure.
Okay. I'm just confirming with legal counsel. Thank you. Okay.
Before we take a vote on this, can I request that we just do all votes by roll call since we do have 2 members participating by phone? That way it's clear.
Yes,
Okay, thanks.
we can do that. Okay, so we have a motion to amend the agenda. So the agenda will then reflect consideration of mask mandate, period, and that the Board of Directors consider mandating masks, period. The rest will disappear. Do I have a motion to approve the agenda as amended?
We have to vote on the.
I make a motion to.
I'm sorry. Hold on 1 second. I apologize. I have a motion to amend. All those in favor of this amendment, we're going to do it by roll call. Cindy, please.
Mr. Goodman,
Aye.
Mr. Greenwell,
Aye.
Mr. Saint,
Aye.
Ms. Scarlett,
Aye.
Ms. Alarcon-Fleury,
Aye.
Dr. Albert.
Aye.
Very well. So, and now do I have a motion to approve the agenda as amended?
So moved.
So
Second.
moved.
Again, roll call, please, Cindy.
Mr. Greenwell,
Aye.
Mr. Saint,
Aye.
Ms. Scarlett,
Aye.
Mrs. Alarcon-Fleury,
Aye.
Dr. Albert,
Aye.
Mr. Goodman.
Aye.
Thank you so much. I'm so glad to see all familiar faces here in the room. Thank you so much. I am very grateful for a community that cares so much. I am very grateful for all the messages, either text messages, phone calls, personal messenger, emails to all my emails accounts. I try to respond to everybody. I didn't get to do that, and I haven't even slept trying to respond to people. And so it is true. So I want to thank you for all those things. Today's discussion is limited to the issue of whether face coverings will be mandated by the board in some fashion for staff, students, and or visitors as part of the district's COVID-19 mitigation measures. As a starting point to this discussion, it is very important to remember that the school board has what it is referred to as limited home rule authority, generally meaning that although the board has local control in some instances, when a state law or administrative rule addresses a particular issue, local control gives way to that authority and this statute or rule must be followed. Relevant to today's discussion is the state law, now codified as Iowa Code 280.31, House File 847, passed on May 20, 2021, that applies to face coverings. The full text of the statute reads, the Board of Directors of the school district, the superintendent or chief administrative officer of a school or a school district, and the authorities in charge of each accredited non-public school shall not adopt, enforce, or implement a policy that requires its employees, students, or members of the public to wear facial covering for any purpose while on the school district's or accredited non-public school's property, unless the facial covering is necessary for a specific extracurricular or instructional purpose, or is required by Section 280.10 or 280.11 or any other provision of law. 280.10 and 280.11 are the provisions of the Iowa Code that require I&E protective devices in certain circumstances, such as chemistry lab or shop classes. From May 20, 2021 until Monday, September 13, 2021, when the temporary restraining order was issued in the federal litigation out of the Sumner District Court school districts in Iowa, were not allowed to issue or enforce masking requirements. At this point in time, until the judge's temporary order is either dissolved or some other court action reinstate the state's right to enforce Section 280.31, public school districts in Iowa have the discretion to mandate face coverings. And so we have heard from the community all this time. All this conversation of mask or no mask has been an ongoing thing since COVID started. This wasn't just a crazy impulse that now we're gonna talk about this. It is a constant thing we have heard from both sides since March of 2020. And so at some point when this law was implemented on May 20, we didn't have any power to do anything. But the opening on May 13 opens the door once again, and we were again approached with, what are you doing? This ongoing conversation took a greater vigor and energy, and what are you gonna do? So to bring it to the conversation is not just some capricious desire. I promise you that if I could go away on vacation today, I would. Or, I don't know who's running for a school board next. But this is a very hard topic, because we're aware that we are gonna please some group and we are gonna not please another group. But the important part is that we need to live with that decision. Also, we took the responsibility and the oath to keep every child protected. And I know parents are responsible for their own children. But when they interact with other children, whether it's an emergency situation or something that maybe in my household I don't know about, but the school knows and they have to implement something in order to protect all the kids, we need to have some sort of authority. And I guess that my big fight, or my big thing had more to do with regaining local control versus, having the governor or the president or a federal judge or somebody else telling us what to do in response to what we see in our local community.
You're telling us.
And so,
You're power tripping. Thank you for the honor.
I need to explain some of the rules then. The room is full, and we have about 23 people that submitted a request to speak today. So you're not going to be hearing from me the entire time. This is our time to hear from you. And then we need to vote. Yes, sir.
This is Dan.
Yes, Dan. Dan? Okay.
Should have been here.
Shall we try again? Okay.
Hold on.
So, Julie, are you still there? Julie?
Yes, I am.
Okay, we lost Mr. Ringo for a moment, so I'm sorry. Could we continue without him?
Yeah.
Oh, I don't
Yeah, I am so sorry. I'm asking my legal counsel what is the right process here.
What the heck?
This congress going to make us.
Yes.
Order, thank you, order.
I'm coming to that. Yes, this is what I'm going to, and that's one of my questions. Can I go through the rules? Director Greenwald knows those things.
I also think it's important that the president follow the bylaws of the school. Do we have a quorum without him?
There is a
Yes.
quorum, sir.
Yes, we do.
And the board president runs the.
Well, then why is she asking?
We'll call on you when it's your turn to speak.
And I look forward to it.
Very well.
Without our kids, you're not going to have anybody to
Normally,
please, you know?
we don't have, when there is a special meeting, we regularly don't have public comment. But this meeting was for the public comment. We normally have 5 minutes, but just in the sake of time, and once again, having 23 different people that are gonna talk today, we're gonna limit it to 3 minutes. So I'm gonna ask you to please look at the most important points that you have in your agenda. The next part of the story is we have policy about the decorum and the order. It is so very important that we show respect and civility. We come from very different points of view. We have the very different perspectives in the room, but we must remain respectful of each other. So according to policy 204.15, I need to keep the order in the room. So I'm gonna need to use the gavel if we become too disrespectful. We are all grown-ups. We all know how to behave in this type of situation. So once again, we're gonna resume and we're gonna do 3 minutes per person, per speaker. And then we're gonna start in the order that these participation requests came in. So Cindy, who do we have first?
We actually have to call Cindy Wade. Is the first one. You have the same ones I have.
Okay, thank you so much.
Quick
They're in
question,
the same
point of order. Do we need a motion before we take public comment, or does it matter? Because, okay, that's just before board deliberations. Okay, thanks.
Very well. Cindy Wade? Is a phone call? Oh, I'm so sorry.
Two calls.
Okay.
Your opposite phone is 712.
Frustration. There are people that cannot be here in person for the several reasons. Hi, Cindy. Hi. This is Perla Flores, School Board President. We have you for your participation or your public comment request. And so you have 3 minutes.
Okay, thank you.
Thank
First
you.
of all, thank you to the board for your consideration of this ability now to mandate masks due to the federal judge temporarily blocking the Iowa law banning school districts from mandating masks in schools. Local control is very important, as we know. The needs and conditions of our city is the best. Vaccination rates are low in Woodbury County and transmission is high. Sadly, currently 29% of Iowa cases are children. The highly transmissible Delta variant has sadly changed the picture this year. The week of 7/28, our county cases were only at 59. New case numbers came out today, and they're reported to be 415, which is quite a lift. We've been watching the numbers every week, and they're going up every week. Due to children under 12 being unable to be vaccinated at this time and the low rate of vaccination in our county, and with 12 to 18, masks will be a vitally important mitigation for all our students and staff. Mandating masks, will protect our students, staff, and parents, and will make our entire community safer. I realize there is division in the community, and this is not easy for anyone. But I strongly hope masks can be mandated going forward. The 1,300 members of the Siouxland COVID Safety Alliance updated our petition 2 months ago, stressing the need for school masks as Delta began through the community and the state and the country. To date, there are 12,600 signatures from parents, educators, grandparents, healthcare workers, and citizens, both here in Siouxland and across the state, who felt strongly about masks to protect our schools. We have spent the last 18 months, along with other nonprofits, in assisting the Sioux City community in multiple ways, donating to many agencies in this time of need, assisting the city with masks for various locations, helping our schools and hospitals with masks and PPE. We made this a priority, and we stand ready to help and assist in any way going forward. Thank you for your time and leadership.
Thank you very much. Thank you. Next.
Eric Bloomberg, and he needs to be called as well.
Okay.
512 745 1905.
I'm calling right now.
Yeah.
Mr. Lombard, this is Perla Flores, President of the School Board in Sioux City. You had a request for public comment, and so I'm calling you.
Okay.
You have 3 minutes.
Okay. I want to appreciate the fact that the board met in emergency session to consider this change in policy. Last year, at this time, we had a mask mandate, and the level of cases was not high among the young people. But now, with the Delta variant being as insidious as it is, I think that it's time for all the students in the district to wear a mask, along with all of the staff to wear a mask to keep the rate of infection as low as possible. There is no vaccination for children 12 and under, younger than 12, and that means that half of our school students are not eligible to receive a vaccine. the highest amount of vaccine of cases now lies in the 0 to 12. That's 29% of the total. So I'm just asking the board to do its due diligence and allow the kids some safety measures to prevent them from catching the disease or spreading the disease throughout the community. That's all I have. I appreciate your time.
Thank you very much, Mr. Blumberg. Have a good day.
Next one is also on hold. Jeremy Dumkrieger.
Okay.
Is he here?
Jeremy Dumkrieger, are you here?
I don't think so.
They're segregated in another room, right?
They are.
They're going to speak or
They can hear.
They can hear us.
It's being televised in there as well.
Hold on real quick. For those that are speaking, we're supposed to be in a different room?
No.
No, we're
Oh,
in here.
okay. I'm like, do I need to be somewhere else?
No.
Okay.
There are people segregated in other rooms that are speaking.
Just for lack of space, but.
Well, there's space
There's
there.
plenty of space.
Plenty of space. Let them come in.
Come in here. We need to see this.
Yes. Okay.
You have the number.
Yes, I do. Thank you.
It's a 7.
We can move on.
Okay. The next one will be Alicia Schmeckpepper. I'm so sorry, I mispronounced your last name. Schmeckpepper, thank you.
I know the CDC is recommending masks currently to mitigate the transmission of COVID. Do I believe that it may reduce transmission of COVID? Yes, it may. But if it may, it may not. Not only do the masks not work the way you would hope they do, they have consequences that should not be subjected onto our children. It is wrong to take the choice away from the individual.
Yes.
In April 2020, the World Health Organization guideline highlighted the dangers of self-contamination, possible breathing difficulties, and a false sense of security. The June 2020 guideline found additional potential adverse effects such as headache, development of facial skin lesions, irritant dermatitis, acne, or increased risk of contamination to public spaces due to improper mask disposal. As of December 2020, the World Health Organization said, at present, there is only limited and inconsistent scientific evidence to support the effectiveness of masking healthy people in the community to prevent infection with respiratory viruses, including SARS-CoV-2. The World Health Organization went so far as to acknowledge that there are emotional and political aspects to mask wearing. One of the World Health Organization's benefits to mask wearing is, and I quote, making people feel they can play a role in contributing to stopping spread of virus. People may feel good wearing a mask because they think they're helping stop the spread, but that doesn't mean what they're doing is actually working. There are several potential negative known risks with wearing a mask for prolonged periods of time. These reasons alone should be more than enough to outweigh the small potential reduction rate of getting COVID that is perceived with wearing a mask. Mask wearing for prolonged periods has well-documented negative impacts on health, including reduced oxygen, increased carbon dioxide, and adverse skin reactions. 0.25% lethality is not good enough justification for healthy people to wear masks to protect others when 99.75% of those who contract COVID will not perish, and the majority of those who will die from COVID have comorbidity complications. Children are the most likely to recover from COVID with little to no complications. Putting masks on children in school limits their ability to learn by impairing face recognition and face identification, impairing verbal and nonverbal communication, and blocking emotional signaling between teacher and student. Like I already said, there are many unknowns and contradicting information about mask use, but where does it end? The virus will never go away. Are we going to mask our children forever? What is known is that my child is my child, and every parent has the right to make decisions on what is best for their child. It is not the school board's place to make health decisions for parents of the children in the Sioux City Community School District. Parents are not asking to ban masks in school. We're not. Parents can have their children wear masks if they want to have their children wear masks. What we are doing is demanding that you let it be our choice.
Ladies and gentlemen, I understand that you're in support of certain positions, but if we're going to have all these, we need to keep certain decorum, please, because we're going to have those that are going to clap for the other side. Please, if you need to leave, please leave. If you cannot, keep certain decorum. Thank you. My apologies. I need to bring on Director Greenwell again.
While you're contacting Mr. Greenwell, I did check the other overflow room, and there is no one in there, except one person who's not going to be speaking and stepped out, but will be coming back. So.
Thank you, Dr. Kim.
Hello?
Hi, bringing you back.
All right, thank you.
Julie, are you still there? Julie?
Yes, I'm here.
Thank you. Thank you so much. Next, Jolene Vasquez, please. Thank you.
I know you said we only get 3 minutes, however, we started at 3:01 and took up 23 minutes trying to figure out your agenda, so if I go over, I do apologize.
You get 3 minutes.
Ma'am, you need 3 minutes.
Thank you for allowing me to be present and speak today.
We have all night.
My name is Jolene Vasquez. I stand before you as a parent voicing my concerns for my family, as well as nearly 2,000 other parents in the Sioux City Community School District over this mask mandate. I have 3 children who attend high school, middle school, and elementary school within the Sioux City Community School District who have been faced with incredible circumstances following COVID-19 and the procedures and policies set in place by both the community school district as well as the health department and our current government. Our children attend in-person learning, and all last school year were forced to wear masks for the entirety of this entire school year until May 20th, 2021, when our amazing governor made it illegal for such a mandate to be forced by any schools in the state of Iowa. The bill signed into law by Governor Reynolds passed 53 to 35 in the House and 29-17 in the Senate, favoring cities and counties not mandating masks within their school districts, citing the state of Iowa is putting parents back in control of their children's education and taking greater steps to protect the rights of Iowans to make their own health care decisions. This law meant it would make it illegal for a school to mandate face coverings for students and staff. Nowhere in this law did it say you did not have a choice to do what you suit best for your family. Now, I created a petition pursuant RSA 197-2 stating we, the undersigned, duly registered voters within the Sioux City Community School District in the town of Sioux City, Iowa, hereby make application to our school board to earn a special meeting to act upon the following question. To see if the voters of the Sioux City Community School District will vote to adopt the following provisions pertaining to requirements to wear face coverings within the Sioux City Community School District. The use of face coverings shall be optional for all students at the sole discretion of their parent or guardian. The use of face coverings shall be optional for any employees and visitors on school district facilities and attending school sanctioned events. I have emailed every one of you on the board, and also those who emailed me signatures on the petition form in addition to creating a petition on change.org that within a few short hours of posting had over 700 signatures in support of stopping the mandate and leaving the choice of the mask up to the parents and the students. By 12 p.m. today, that number jumped to nearly 2,000 signatures. I want to be clear, if you vote for a mandate, I have a petition already started, and I have brought copies with me, so if we need additional signatures, please let me know. You mentioned you want control on a local level and don't want to be told what to do. However, you are trying to do just that. I've added screenshots for reference. They're in my binder if you would like to look at them. After much demand from like-minded parents...
Your time is up, Jolene. Thank you so much. Thank you.
Thank you, Jolene.
Thank you.
Well,
okay, who's next?
I sent it to the entire board.
We have it. Thank you. Who do we have next, Cindy?
Megan Larson.
Megan? Thank you, Megan.
Good afternoon. I would like to say, as a parent, as a school employee, I work in high school, And I see how, I don't know the word I want to use, disrespectful high school kids are when we have to say, you have to put your mask on, you have to wear your mask a certain way. We're the ones that have to get cussed out, or we're the ones that have to have rude students to us because there's a mandate. As a parent, I don't want to fight with my 6-year-old and my 7-year-old in the morning because they don't want to wear a mask to school. I don't want to pick up my kids from school saying, I'm miserable, I hate this mask, I hate school. I don't want to fight that in the morning. That's not fun. That doesn't want to start their day good. It should be the parent's decision because we know what's best for our kids. And as a school employee, I see how disgusting it goes from, I've worked in elementary school, I've worked in a high school. I see how bad it is everywhere. They wear it on their chin, they take it and they shoot it to see how far everybody can shoot it. It doesn't make any sense. Nobody's saying that they can't wear it. If they want to wear it, fine. I think we should make it anybody's choice, not a mandate.
Thank you. Okay, next. Stacy Alex. And that's a cold as well, okay.
Hello.
Stacy, this is Perla Alarcon-Flori with the Sioux City School Board. You have a request for public comment. You have 3 minutes, Stacy. Thank you.
Okay, thank you, Perla. I would just like to speak on behalf of all the families with compromised immune systems or other health issues. My 1-year-old son has asthma, and so we are terrified that my 5-year-old who attends Irving is going to come home and bring COVID to our house. My husband also has asthma, so this is something that we continue to be concerned about. And I also would just like to thank. I just found out today after writing to the Iowa American Pediatric Association. I asked them if they would speak to you today, and I was very pleasantly surprised that Perla has already been in contact with them. And so I'd just like to thank her for doing her part to make sure that she's well informed and that she is sharing the most up-to-date research with all of you. But I don't know if she's already shared this information with you or not. And I did email the board as well. I know you have lots of emails to get through. But that association has recommended universal masking. And I think that they make a very clear case as to why that is the most ethical choice at this point. And again, as I said in my email, my son is only one of 3 students to wear a mask in his class, so the chance that he's going to bring it home is pretty high, and it's very concerning for our family. My husband and I are both educators, and we wear masks in our classes. We ask our students, I ask students to wear masks. My husband works in a public institution, so we'll see if they're going to change. They're going to also have a mandate in place. Fingers crossed. So I don't want to take up any more of your time other than to say that I know this is a really tough choice, and I know that the parents who would rather their children not wear masks, their voices might be louder, but this is no longer a question of individual rights or individual choices, right? The choice that each one of us makes affects every other person, and so we have to stand up for each other.
Thank you.
All right, thank
so
you
much.
for your time.
Thank you.
Thank you.
Thank
Bye-bye.
you so much. Okay, once again, we're gonna have divisive ideas. We need to respect that, please. That's the only thing I'm asking, civility. We had a growing number on Don Krieger.
Oh, we did?
Yes, so I'm gonna call him again.
Okay.
Hi, Jeremy, this is Perla with the Sioux City School Board. You have a request for public comment. You have 3 minutes.
Thank you, Perla. My name is Jeremy Dunkrager. I'm the father of 2 recent graduates from the Sioux City School District, and currently a teacher in the district. and am speaking in favor of the mask mandate. Last week my nephew spent time with his grandmother. The next day he felt ill. The next day he was diagnosed with COVID. He got this from a masked student in school. Days later, my 7-year-old mother was diagnosed. The following day, my nephew's sister, my niece, was diagnosed. This could have been avoided if masks weren't throughout the school year. COVID may be here to stay, but it doesn't mean we can't battle this to prevent kids who are too young to be vaccinated and those who, through no fault of their own, have yet to be vaccinated. Ambulance services such as Mapleton Community have released statements saying that hospital beds in Sioux City may not be available in the short-term future because of medical needs. People will go without services, mirroring the crippling hospitalization services in the South. Masks help stop community spread. I ask the board to mandate masks, but also to educate both teachers, staff, and students on why and how viruses spread, how masks work, and how vaccines slow the spread. It is our duty, and I ask you please to vote to mandate masks in our schools. Thank you, Perla.
Thank you for your time. Very well. Tasha Cohen. Tasha Cohen.
Where's that, sir?
Tasha, I'll need your address too. 2100 Villa Avenue, Villa Avenue.
I know that the law was overturned by a federal judge in recommendation by parents with children with disabilities. I am a parent of a child with disabilities.
Microphone.
Could you use your microphone? I don't think they can hear you in the back. Thank you so much.
I have 2 children with disabilities. I have a son with cerebral palsy who is 10 years old. When he has to walk with his walker and he has a mask on, he becomes exhausted. He cannot breathe properly. He gets tired and he has to sit down and he cannot keep up with his peers. That is not fair for him when he can do that perfectly fine when he is unmasked. I have a child in high school who has autism, who has sensory problems, and can't stand the feel of a mask on his face. And face shields don't work. I don't know what you think that those are accomplishing, but they're not accomplishing anything. And he has panic attacks when he wears those. He also is deaf in his right ear and he reads lips. So therefore, when he cannot see people's faces, he does not know what they are saying or how they feel. We need to think about children like that. If you're, honestly, the disabled children are the ones that it is unsafe for them to wear masks. They're more susceptible to respiratory problems, which masks can cause because you're breathing in moisture, which can cause bacteria and mold to grow in your lungs, which will cause RSV, pneumonia, and other respiratory issues. We cannot make our children wear masks. Are we going to mask our children every day of the rest of their lives just because of this virus? It's never going to go away. It's never going to get better. We have the flu. We have different variants of the flu and influenza every single year. Why are we having to wear masks now when we didn't have to wear masks before, when there was the flu, when there was the rotavirus, which is the stomach flu? These are all viruses. I don't understand why we are being told that they have to wear masks now. We have been fine. And not only do kids are not just in school. They're playing with their friends outside of the school the minute they walk out the door unmasked. They're going to activities outside of school unmasked. They go to grocery stores. I mean, are you thinking that our kids go to school and go home and that's where they stay? That's not my life. You cannot say that an unmasked child at the school gave another child corona or the COVID, because they could have gotten it anywhere. They could have gotten it at a grocery store. They could have gotten it at church. They could have gotten it anywhere. It's not just the school. If you are sanitizing and everything properly, you should be fine. And not to mention inside the school, they're sitting right next to each other at a lunch table, mask off. They can't eat with the mask on.
So what is the point of making them wear a mask all day outside of the lunchroom?
Thank you, Tasha. Thank you so much. Amanda Gibson.
Thank you. I would ask that if any of my statements are interrupted, the time be paused to let me finish. Madam President, Mr. Superintendent, and Directors, thank you for allowing me the opportunity to address you once again. Today, I would like to speak to you on the issue of the potential mask mandate in Sioux City schools. We, as education advocates and leaders, have a responsibility to adhere to scientific research. Ignoring scientific fact while teaching it in our classrooms is hypocrisy in its purest form. We are teaching our students to do their own research, find credible resources, and weigh the information without bias. Yet, sadly, there are many people in our community who have forgotten those skills. I ask you to remember that the loudest voices are not always shouting the facts. As school board members responsible for the safety of our children, you do not have the luxury of forgetting how to weigh data and make informed decisions. In a ruling on Monday afternoon, federal judge Robert Pratt said, "The court recognizes issuing a temporary restraining order is an extreme remedy. However, if the drastic increase in the number of pediatric COVID-19 cases since the start of the school year in Iowa is any indication of what is to come, such an extreme remedy is necessary to ensure that children are not irreparably harmed." The week before school started, Woodbury County had a 14-day infection rate of 6.8%. We are now at 13.5 and still climbing. Research has revealed that since school started, 26% of all positive cases in Iowa are children. As Judge Pratt thoughtfully observed, the time for extreme action is here and is necessary. As of today, the global health crisis identified as COVID-19 has claimed the lives of 233 of our friends and neighbors in Woodbury County. One final piece of data I will share with you is from a poll from the Sioux City Journal. As of this morning, 60.7% of their readers support a mask mandate for schools. Forgive me for repeating some of my rhetoric from my address to you on Monday night, but it bears repeating. Those of us who have been vigilantly protecting our children for nearly 2 years are physically, emotionally, and spiritually exhausted. We are begging for your help to protect our children. Parents do have the right to decide what is safest for their child, but if that right conflicts with what is safest for all of our children, and that parent doesn't want their child to wear a mask, then it's their turn to keep their child home and enroll in virtual learning. It's their turn to give up their careers. It's their turn to explain to their young children why they can't participate in activities with their friends. Your responsibility is a heavy one, and I appreciate your time. And I hope that you will decide what is best for every person in a Sioux City school building and vote today to re-implement the mask mandate in schools. Thank you.
Thank you. Next. Okay. Is Dan Youngblade here? Oh, thank you.
Good afternoon. My name is Dan Youngblade, and I have 3 children at Perry Creek School, a 4th grader, a 2nd grader, and a kindergartner. First and foremost, I want to point out that I find the time of this meeting rather curious. I think there'd be a lot of other parents like me that would like to voice their opinions, but they are at work or currently picking their kids up from the schools we're talking about.
Yes.
Secondly, I want to voice my displeasure for another potential mask mandate. We send our children to school to learn facts, and the fact of the matter regarding masks is that there's no scientific data proving that they work. Other states and even other countries with the strictest mask mandates and COVID restrictions have had basically the same numbers as the places without them. We're also talking about a part of the population, school children, that are at a very low risk of dying or being harmed by COVID-19. It disappoints me that our school board is once again considering this political cosmetic theater. I call it this because these same children, as soon as they leave school, surely won't be wearing masks when they're out to eat with their families, at other school activities, playing football while attending local events. If you're an at-risk child or the parent of an at-risk child, by all means, send your child to school wearing a mask. However, that should be a personal choice for each individual family to make. Finally, I really haven't heard of any big upticks of COVID-19 currently happening within the schools, and the majority of kids haven't been wearing a mask to school for 3 to 4 weeks. To be honest, I don't know why we're even considering this mandate when we really haven't been made aware of any increasing or dangerous COVID-19 issues, since school started. Thank you.
Thank you. Okay.
Is it easier to have it on your phone, you think? Because otherwise I have to disconnect Julie every time.
Okay.
We lost Dan again. Okay. So I'm just trying to figure out if it's easier to have him on the cell phone, otherwise I would disconnect Julie every time that he gets cut off.
On his point, I know he's either driving or
Yes,
riding
he's
through
in
the
the
mountains
Yes,
in Denver,
we
so
know.
I'm sure he's seeing intermittent.
Yes, I understand. Okay, do you have it, Monique?
Yeah, I'm calling him now.
Okay, our next person, Cindy.
Dustin Johnson.
And he's on the phone?
Hi, Dan, we have you on speakerphone.
Okay.
He's here.
Oh, he's here?
Yeah, I think he steps out for a second.
No. Dustin Johnson?
Yeah, he had to leave, but if you're calling him, that'd be.
Okay. Mr. Johnson?
Yes, hello.
This is Perla with the Sioux City School Board. You have a request for public comment. It is your 3 minutes.
Okay, thank you very much. I do want to be very clear that I am not anti-mask. I am not anti-vaccine. And I feel that those are a person's personal choice. However, I am opposed to mask mandates because I feel that these are oversight or overreach by this board. And I don't feel that it is this board's decision to make whether a student, a faculty member, a staff member wears a mask. And I'm afraid that the conversation that we're having in regards to this mask mandate, that the decision's been made already. That I feel that this board has...
Are you there?
Other outside agencies, and that I think that this mandate is going to be rammed through without any other taking public thoughts into consideration. And so I do want to emphasize that I think that this is our choice to make as parents, as teachers, and I strongly believe here too that voters are going to be paying attention to the actions and ideas put forth by this board, and this is, I think that's something that needs to be taken into consideration. So, that's all I have. Thank you.
Thank you so much for your time. Thank you. Next.
Kim Lauer.
Mrs. Lauer.
Hi. I just want to be, first tell all of you, thank you for everything that you do for our staff and our students. I know you are in a thankless position, and we want to thank you. I'm standing up here on behalf of many teachers at Nodland Elementary, and I sent all of you a letter last night. I know I'm not going to stand up here and read that letter because it's a lot of duplication of what you're hearing. But the first thing that I want you to do is think, I teach kindergarten. I have some of the littlest students in our district. They don't want to wear a mask. They don't know how to wear a mask appropriately. Their mask is down here. Their mask sometimes is swinging in the air. Sometimes the parents don't wash the mask. They have the same mask from Monday, the same mask that is there on Friday. That is not healthy. We are not anti-mask. We accept all of our students, and if they choose to wear a mask, that is their choice. We accept it. I haven't had any of my other students say anything to my children, which is 1 or 2, in my classroom, say anything to them. They are accepted. It is our choice. It is the parents' choice. When you say, this is what's best for our kids, you're actually telling us as teachers, we don't know what's best. You're telling these parents, they don't know what's best for their children. We all know what's best for our own students. I have a hearing impaired student in my classroom. I can't teach them the sounds when they can't see my face. I have students who don't speak English. They need to see my face so they know how to articulate, how to make a letter sound, how to read. That is not what is best to mandate for me to wear a mask. The other thing is that hasn't been talked about is the climate in our building. If you mandate this, our climate, our workplace that we go to every day is not going to be a happy place. You are going to have teachers who are not happy to come to work. And that makes me very unhappy and sad. The last, because I see I'm running out of time, is as a board, you approved us to be an IB school. We are going through that authorization now. One thing that we talk about is agency, and that is voice, choice, and ownership. You're taking that away. Very hard for me to teach that when I don't have my own voice, choice, and ownership.
Thank you very much. Joshua Potter. Joshua Potter.
Hi, my name is Josh Potter, and I'm speaking in opposition to the mask mandate today. Thank you for having this meeting and giving us a voice to share our thoughts today. Every day in this community, 90 to 95% of parents and students and teachers are going to or sending their kids to school without a mask. I have talked to teachers, students, and parents from every one of the major schools, the high schools and middle schools. I have a kid in middle school and 2 in elementary school. And every day I see the same thing, 90 to 95% of parents sending their kids without masks, or students showing up without masks, teachers showing up without masks. There's a very small number of students wearing masks. These are people who are voting with their actions. They're telling you that if they feel safe sending their kids to school or teaching at school without a mask to the tune of 90 to 95% if you step in our schools. To those who feel truly unsafe sending your kids to school or teaching school, you have to do what is best for you. If your student or a teacher wants to wear a mask, they can wear it. If they want to wear a mask, I encourage them to do so if it makes them feel safer. I know that if I felt like my child was not safe, I would do whatever I needed to do to ensure their safety. I would move schools, I would homeschool, I would change my hours, I would teach online, I would quit my job if the safety of my child was truly in question. We have a great option in Siouxland to send our kids to Vibe Academy. If you feel unsafe, please send your child to Vibe. They can get a great education and have the safety you desire to have for your family. Now, for those who may be more vulnerable, teachers over the age of 65 or students with special needs or vulnerabilities, there's a small number of teachers in the age group to begin with, and if they don't feel safe, they've probably gotten the vaccine, or they have, or they wear a mask, or potentially both of those things. We have a group of special needs students that comes to our church on a regular basis and uses our playground, and we've allowed them to do that, and never have I ever seen one of those students wearing a mask. Their parents are not sending them to school wearing a mask. There's also a smaller private school in our community, which you may know of, that did not require masks last year, which did not see any spikes. They did not have to put in any extra mitigation practices throughout the year, and they didn't have any closures to their school. While it's a smaller sample size, it's still a picture of safe education in our community. You represent our community, not Des Moines, not Iowa City, or not Cedar Rapids. You represent our community, and our community is speaking loud and clear to the tune of 90 to 95% of students and teachers every single day that are speaking loud to you that they feel safe sending their kids and teaching without a mask. I implore you to use sound judgment while representing our community, while serving on this board. Represent the students, represent the parents, and represent the teachers who are going to school every day without a mask by voting no. And let's encourage those who are genuinely concerned about their safety to attend Vibe Academy until they feel safe again. Thank you for your time.
Jason Geary.
Thank you. Thank you, Board. I respectfully speak today in opposition to the proposed mask mandate. If in your mind's eye, if you would go back to May of this last year, we were all surprised when the governor passed a mandate that took away your ability to enforce masks inside the school district. And if you are like me, you remember the morning of school that kids are showing up, teachers, staff showing up without masks, without clear recommendations about what was supposed to happen. And we all were frustrated until the school district finally announced that, hey, we understand the governor's done this, and we are going to go ahead and honor that request. I feel like if you choose to enact a mask mandate here, you're setting us up for the same possible outcome again. Even if we don't admit it openly, we all see that COVID-19, especially the regulations around it, are highly politically charged. Very few people within the community probably don't have strong opinions about masks, shutdowns, stay-at-home orders, and vaccines. But in short, a Republican legislature and governor signed the ban into place. A Democrat judge has now struck it down. The Republican governor is sworn to fight, and around we go. If you take the D's and the R's out of it, the simple equation is that our checks and balances system is playing itself out. And that's the system we teach our children, it's the system we all grew up with. We know that it's a process. And we also know this, or I believe this issue is not over just because one judge says it is. This brings me to my core point. This issue is probably going to go to the 8th Circuit Court of Appeals. And no one in this room knows what the 8th Circuit Court will do. Any honest attorney can clearly show that the 8th Circuit Court doesn't have any precedent around mask mandates, and they haven't had a case that's anywhere close to this type of issue. It's highly unlikely to predict what they're going to do or say one way or the other, save two things. They are highly likely to review it. And second, their decision is going to carry far more weight than a circuit court judge's opinion. Just imagine the 8th Circuit in a few weeks striking down the judge's order at 10 a.m. some morning, and social media and general media explode with the information on the web. You think kids aren't going to be ripping their masks off all over again, and you guys will be racing to try to catch up to figure out what to do or not to do in the same situation? I think you're walking us down the same predicament as before. So my proposal is simple. Whether you want a mask mandate or whether you're against it, I think there's a healthy amount of wisdom in waiting to see what the 8th Circuit is going to do on this matter. Whichever way this 8th Circuit goes, that ruling will carry far more weight. It also has much more likelihood that it's going to stand versus a single judge opinion. Even though I personally would still oppose a mask mandate for many of the other reasons that were mentioned here today, I think if you hold off on the mandate till at least that point, that very few people in this community would think that you've been unreasonable in rushing on the issue and setting our kids, teachers, and students up for the same challenges we faced on that early May morning when we were dealt a hand of confusion and concern about another change to another mandate.
Thank you, Jason. Thank you very much. Derek Winkle.
I'd like to say that a lot of what I'm going to say has already been said, but I think it's important that you guys hear from many of your constituents. Before I start, I'd like to thank the Sioux City Community School Board for giving me the opportunity to speak about the proposed mask mandate in our district. I would prefer not to be here speaking before you today, but I felt strongly I didn't have a choice in the matter. The reason for this is the board's irresponsible decision to hold this special meeting at 3 p.m. when all stakeholders in this matter are either picking up their children from school or working to support the needs of their families. So I'm here today on their behalf to address the board members regarding the proposed mask mandate. First, I'd like to discuss briefly how we got here. Our duly elected state legislators voted to enact a no mask mandate in our local school districts. Then our state's duly elected governor signed this bill into law. Then on Monday, a federally appointed judge opted to temporarily block this law. Consequently, a biased school board member immediately opted to put this issue up for a vote without comment from the stakeholders. And here we are. The hypocrisy of the matter is the board member is doing to our children exactly what she didn't want done to her. Someone with a different viewpoint imposing their beliefs on another. So I come before the board today with a much simpler, less divisive solution on this polarizing issue. Stop imposing your beliefs on our children and act in a manner that's best for all stakeholders. If you want your child to wear a mask, let them. If you don't want your child to wear a mask, let them. Then everyone gets what they want, and we can truly have unity in our community. Oh, and if you're afraid of the maskless students, you can stay home and learn virtually while the rest of us move on with our lives.
Thank you. Matt, I'm sorry, I can't quite read the handwriting. Jamina? I am so sorry. Hi, Matt.
I'm going to skip a lot of what I had because it's been said, but just want to point out a couple of things. Today we're at an emergency meeting without an emergency. Nothing changed other than ruling. We have educators playing politics instead of educating. No wonder our kids are falling behind. Our educators think they're doctors giving medical advice and testing. We now have a virtual school that we set up all summer for those who think it's too risky to participate in a normal society, yet that is not enough. We watch cable news network and we look at what Des Moines is doing and we follow along. I guess your return to learn plan wasn't that good, that we're adjusting it with one judge's ruling. We all know that you pretty much all made your mind up. And you don't want to listen to the people who elected you or to the kids that are your bosses. So we will watch you mask those kids up as you get on your plane later tonight, just like every other politician has, right? I asked you to table this and use the plan that you came up with at the beginning of the year until the real emergency has already began. And I just want to point out, some of you wearing masks are wearing them incorrectly. So you implementing a mask policy is like having a driver's ed teacher without a license.
You want to hold?
Yeah.
Again, thank you. Peter Sieben? Sieben, I'm so sorry. Sieben, okay, I said it right the first time.
Doesn't matter, I've been called a lot of words. All right, I just want to, the reason I'm here is because I have a senior at North High that asked me to come. So I pulled a few stats off the interwebs, and you can find information from either direction if you go look for it. Everyone knows that. Younger people 17 and younger have the highest survivability, lowest severe infections, and the fewest deaths. The rate of death is 4 times higher for 30 to 39-year-olds and 570 times higher for people 85 and older. That's not what we're talking about. We're talking about kids that, for the most part, are less than 12 years old. Data includes all hospitalizations and death statistics from the National Center for Health Statistics from 3/1/20 to August 1st of 21. So this is not a small sample size either. Many prominent scientists believe that requiring children to wear masks all day at school can do more harm than good. The research on using face masks are not conclusively positive. Statistics show that infection rates are not changed significantly between masked situations and unmasked situations. Almost identical. Data collected by the COVID-19 School Response Dashboard found that schools without mask mandates, in fact, Some have actually had lower case rates than schools with mask mandates. Face masks were designed to be worn in hospitals to prevent saliva droplets from landing on patients and other staff. For students wearing a face mask for 7 hours a day, think about that. Now let's add on some of them extracurricular activities, number 10 hours a day, along with the social distancing and constant reminders of the danger, present some hygiene, health risks, and significant mental health problems for a lot of these children. They're growing up with no confidence. They don't know what the next guy's thinking. They can't see it in their face. The human body is designed to expel waste through exhaling. Holding those wastes against the face creates a whole new set of problems as children inhale the bacteria and viruses their body is trying to get rid of and waste it in a moist environment on the skin. Now I'm going to quote somebody, you might know him as Dr. Fauci. This goes back to March 8th of 2020. There's no reason to be walking around with a mask. You're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think it is. Often there are unintended consequences. People keep fiddling with the masks and touching their face. My son, in addition, spoke to one of his teachers, and I'm not going to give you her name because I don't want any reprisals against her. But she said, I really have a hard time hearing students when they're wearing a mask. Most of his friends, when asked, say, you're not my mom or my doctor. You can't make me wear a mask.
Thank you.
A kid named Noah from West.
Thank you so much. Bernie Escalero.
My name is Bernie Scalero, and I'm a retired school counselor from West High School. In 1989, I spent a few days getting to know a family that had recently lost 2 of their loved ones. I was working at Catholic Charities that year when United Flight 232 crashed at our Sioux City Airport. About a week later, I was asked by the family and flown to Colorado Springs so I could attend a double funeral for a 38-year-old mom and her 11-year-old daughter. What not everyone realizes is that Sioux City's medical and emergency response personnel had recently gone through a simulated airline disaster drill before that actual crash. In other words, they prepared. They didn't wait till disaster struck to figure it out. Last year, our district goal was to be fully in person, and we struggled with you in deciding if and when it would be safe to do that. I am not in the schools this year, but obviously am aware of the increasing COVID cases. I am here to ask 2 things of you. 1, you lead with your heart. You lead with your conscience, not just what's popular. If you feel it's the right time, go for the mask mandate. Because, and I'm sorry for my language, but it's half-assed for some to do it and some not, for some rooms to do it and some not. I believe that it's how I got COVID last year. And at the same time, when I was recovering, my neighbor, my friend, died. My second ask is that if you choose to wait, then you prepare. You decide now what it will take for the mask mandate to be in place, and you be ready to implement it as soon as you need to. No one expected a plane crash in Sioux City in 1989, but it did. And they were prepared and they saved lives. No one expects to die from COVID, but they do. Thank you.
Thank you. Mike Bushby, right? Bushby? Thank you. I'm sorry.
Thank you for allowing me to speak today. My name is Michael Bushby. I have 2 children who attend North Middle School, and I'm here to appeal to you all to reinstitute the mask mandate for all Sioux City public schools. I'm here to appeal to you as educators. I ask, how can you possibly teach my children about science if you deny the scientific data that supports masking as well as vaccination as crucial to the controlling of this pandemic? How can you possibly teach about history when you ignore the parallels to our eradication of prior diseases like polio and smallpox, or the measures taken to but the parallels between this and the 1918 pandemic. How can you teach about civic responsibility while failing to take any, despite recommendations coming from every learned and official source available to you? I also appeal to you as parents. Our children do not suffer due to masks. Our children suffer because of fear. I'm talking! Fear comes from unpredictability and uncertainty, not from a mask. We alleviate uncertainty when we act decisively and we show caring and fully embrace our duty to protect our most precious and most vulnerable population. And I ask you to do that today. I'm also here, obviously in scrubs, to appeal to you as a healthcare professional. Since March of 2020, I have worn a mask 40 to 60 hours a week. My kids have worn them to schools all day, every day. There is no evidence at all that masks are harmful. I'd be the first one to be demonstrating that they present a problem. I have worn just a surgical mask like I'm wearing now. I've worn an N95. We now wear respirators in the hospital when caring for COVID patients. I also have the unfortunate duty of transporting expired patients to the morgue. I have wheeled the bodies to the morgue. That is not something that I take lightly. And that has its own trauma and harm to mental health as well. We are tired. We are tired of opinions rather than facts driving this debate. So in closing, let me add a couple of key facts here. Fact number one, the American Academy of Pediatrics recommend masks in schools for everyone over 2, regardless of vaccination status. Fact number two, the AMA states we strongly support the updated recommendations, which call for universal masking in areas of high or substantial COVID-19 transmission and in K-12 schools to help reduce transmission of the virus. Fact three, due to the circulating and highly contagious Delta variant, the CDC recommends universal indoor masking by all students aged 2 and older. I'm going to abbreviate. Fact number 4, the WHO and UNICEF advocate for masking. Number 5, the National Association of School Boards. And fact number 6, the National Educational Association.
Thank you so much. Thank you.
Recommend universal masking.
Time's up. Thank you.
Order, please.
You talked way longer.
TikTok. Please, once again. Thank you. Diana Navarro.
Hi. It's nice to finally meet you guys and gals. So, I have here showing a few questions that I asked whoever answered the phone when I called this morning here at the district. I asked about if there's going to be a medical and religious exemption, because like many, I already believe you guys have made up your minds. Yep. She didn't know. Then I asked her, well, if there aren't going to be any exemptions, will there be virtual learning available immediately for the kids that will not wear the mask? And she said that it will be available at the end of the quarter, October 26th, if qualified, because now it is a school. So you have to apply. I asked her what will be the reprimanding that the kids will have if they don't have the mask on properly or choose not to wear one, since they can't get out of school, right, until October 26th. Or you'll come after the parents, of course. She said she didn't know what the reprimanding will be. I asked about the mental health of the children, because they will not be able to see facial expressions, just like I can't see yours. Well, yours too. And I'm wondering if there will be a waiver that I can sign for my children not to wear a mask after you mandate it. So when I looked at the SiouxLandDistrictHealth.org website, because I called them and they didn't know how many deaths have been in Woodbury County. They couldn't tell me. They could tell me the infection rate, but they couldn't tell me how many deaths there had been. And I asked her, just in general, what do you think? She couldn't answer. So she directed me to the website, and I found that there have been 233 deaths. And here it says total positive tests as of 9/8, but then it says the new cases beginning 8/9, so I don't know. But it's on the website, so there's it's 17,885 positive tests, 233 deaths. So then I looked at the New York Times and found that in the time that the school started, August 20th to September 14th, there have been 2 deaths in Woodbury County, and that's what I've seen so far. So I'd like those questions answered before you implement masks, because this is a school to prison pipeline you are opening up. These kids in high school, I have 3 of them, and they will be reprimanded, and I don't know how, so I don't even know how to protect them from that.
Thank you very much. Thank you, Diana. Anna Fisher. Anna Fisher.
Good evening, everyone. So a lot of people have, at least, a lot of people have already hit on many of the notes that I wanted to discuss today. So I'd like to tell you a little bit about some of the other things that are personal for me. Over the last year, my son finally started talking. He has autism, ADHD, and he has finally started speaking to me because he was able to get into a program and go to school through preschool and be able to have the visual of his teacher's face and be able to work with speech therapy and be able to develop those motions of his mouth. He's finally started to make friends, and he started now this year through the school in the TK program, and he comes home every day, finally, telling me how much he loves school. Isn't that what we want for our kids? We want them to love their education and their school and their teacher and to make friends. He's telling me about his friends he's making. All of these things are new for me in the last year. He didn't make friends. He didn't have people that he talked to. And I'm sorry for getting so emotional, but we just got his diagnosis of ADHD and autism in the last 6 months. And so I have worked so hard in these last 6 months now to be able to get things in place for him, for therapies, to be able to get paperwork in place for being able to get special education through the school. Additionally, he has food allergy things, so I've had to work with food allergy things and food allergy modifications. It has been really hard for me to get him just to be able to get into school. And he's not going to leave a mask on his face. His autism and ADHD, 2 seconds after I tell him to put a mask on his face, he's touching that mask and taking that mask off, and yep, that dress-up time was fun, and he's moving on. I can tell him and tell him and tell him, and his amazing teacher and his amazing special education teacher can tell him and tell him and tell him, and he's not going to leave it on. He's not. And as they said, what repercussions are going to come for him from that thing? Is he going to get in trouble? Is he going to start coming home to me and telling me he hates going to school? Is he going to start to regress and become nonverbal again? I don't know. But these are real fears, these are real problems for me. Because I finally got him so that he is able to get to school and he is able to learn. And I know all these other parents that are for the mask mandate, they're worried about their kids too. They want the help for their kids too. My son's health is also an issue. He has a lot of respiratory issues as well. So he's one of those high-risk kids. I wouldn't be standing here saying I didn't want the masks if I wasn't also one of those high-risk parents. But the fact is that the masks aren't helping. If you look at the actual microns that they filter out, it's not working. It's not.
Thank you so much.
Thank
you, Anna. Angerman. Crystal Angerman.
Hello.
Hi.
I just want to let y'all know that I was a dental assistant for 5 years, so I was trained in infection control, okay? If you go back to the old videos, saliva with red, those masks are doing nothing for you, okay? Anytime you touch a surface and then touch your mask, it's cross-contamination. And you expect a little child in kindergarten to do that? Unlike these people that have been here today saying that the virtual is for those that are scared of the coronavirus, I've used it the other way. I chose not to enroll my children back in school because I was not going to let you control them, okay? And so I have been doing virtual from the beginning because I am not scared of the virus. I am scared of why they are treated like prisoners and had to meet, to sit in hallways and stay 6 feet apart and think that that's okay. My husband caught COVID, okay? Tested, we did not quarantine away from him. I slept in the same bed, I rolled on those sheets, nothing. We caught nothing. Do you know what he did? Tonic water, ibuprofen, and zinc, and he was better in 3 days. We did not catch anything. My children have had a blessing from this COVID. I've been able to be there for them, give them the education that they need, the help that they need, the one-on-one help. It has not been a checklist for me to make sure that they have learned something in school. I'm making sure that they actually understand it. I get that these teachers are busy, but it is so much of a checklist anymore of whether they have something to get done. These kids don't even get it. My child's been left behind in the reading program. She's in 2nd grade and still can't read. And you're giving her assessment tests, and she can't read it. So technically she fails, even though she can comprehend it better than some of your readers. There's a failure in the system. Our children's right to the 14th Amendment to be chosen, to be treated equally is being taken away. You guys are giving them assignments on coronavirus, climate change, and Agenda 20. My child was submitted to this assignment. He gave you guys gave the school system answers, and the answers are not appropriate. He needs to go back and redo it. He answered it just because he doesn't believe the agenda and doesn't go into the indoctrination. Now he receives a score of 60. We'll take our 60 and we'll keep our opinions.
Do we have anybody else, Cindy?
Bob Lessman.
Bev Lessman?
I'm going to take a real different approach because I'm a man. But anyway, I thank you all for probably my combination of stuff I sent you today because I did it kind of last minute because I heard on TV you couldn't speak. So I was trying to get that to you for today. So my apologies for all that stuff that got stupid and mishmash. So I just want you to know that on Channel 4, I don't know who's here, KGIB, they just had on, I think, the 28th of August, they had scientists showing that wearing a mask, a cloth mask, was only 10% effective because of what's coming out, what's coming inside, and what's going underneath. And they demonstrated, and I sent those videos to you, the ones that got it, that you'd have to have a mask, a dryer sheet, another mask, put it on, and then also the gaiter to even kind of be effective. And that was not anybody saying it, but right on NBC News, which is usually kind of mainstream, you know what I mean? So guys, I just want you to know that not only they take them off, whatever they wear may not be that effective. So I want you to know too, I'll get to your eyes too, Ariana. My sister-in-law died of COVID last year. It's her birthday today, put it in. So I understand that there's death, but my mother-in-law got the shot and it pretends to care with a heart attack. So I just want people to know that there is no black and white issue on this. I think we have to do the best with what we have. I don't think we should give in to pressures from other school systems. I think that we should do what is right, and our legislations and our governor voted for this. And I wanted to know also, whatever you decide today, can it be changed when? If you guys decide there's a new group of people, comes up again for a vote, what makes this permanent or what doesn't make this permanent? You can answer that maybe a little bit. And also, I'm trying to think here. Oh, I know one thing I was going to say is my sister's a nurse, she's BSN, and when she went into administration, what she wanted to tell everyone was she was never going to forget what it was like to be on the floor. And that's why I appreciate the teachers and the ones that are actually on the floor and are seeing what's going on. So I want you guys all to remember too how much vouching other people have flip-flopped. Wear a mask, don't wear a mask. Wear 2 masks, and wear this. So I want you to remember that. So things change as things go along. And last but not least, I want to tell you a little story about the lady who sent home in high school, 17 years old. Says, Mom, I'm going to go to an R-rated movie. I know you're supposed to be 18, but I'm 17. But it's not that bad. Which is not a problem. You make a decision. So I want you to know when you bring your friends home to the movie, I'm making brownies. I just want you to know I'm putting just a little bit of dirt in the garden in there. Now it's not that big a deal, because it's just a little bit. And the next time, I'm going to add a bit more, a little bit more, a little bit more, until finally someday, you don't even know it, you're just eating dirt. So I think we need to watch the progression of things also in health.
Thank you very much. Thank you. That's it. Thank you so much for coming today. Thank you for your comments. Board members, do we have any discussion on this item?
I know Director Greenwell on the phone. Director Greenwell, can you hear us?
I can, yes, thank you.
Do you have anything to say, Director Greenwell?
Are you directing this to me or Perla?
Yeah.
Oh, sure. I mean, I appreciate all the speakers who have spoken today, both for and against masks. I think there's sincerity on both sides. What I want to do is think back last year when I voted to have masks and voted for the mask. At that time, I thought the majority of the people in the community wanted masks and were looking for some level of security. Since that time, I think with the vaccination rate, with other things going on, and people seeing that we can manage this process, I think, in my opinion, the majority of the people don't want the mask at this point in time. I know one speaker, excuse me, let's keep order. I know one speaker spoke about the infection rate of his family and his mother and relatives, and yes, that does happen. I recognize that. I've also heard from a number of family members and parents saying that there is harm to they believe there is harm to their students, psychological harm, emotional harm. So when we talk about keeping all students safe, we have to consider those matters as well. There was one, we received hundreds of text, emails, and phone calls on this topic, and there is one person that sent me a note and may have sent all the board, I don't know, it was only addressed to me, but she may have sent it to everybody. And it probably was the most personal, eloquent, and humble statement that she made. And it really weighs heavily on me. And I actually sent her a note and said, I've read it about 5 times. And since then, it's really with me. And her name is Jessica Davis. Jessica wrote, "My name is Jessica Davis. I'm not fancy nor rich. I do not hold a public office. I do not have a medical degree. I do not have a PhD in science. I am not a professional in any capacity. In fact, I'm not really important at all. Unless, of course, you are Noah Davis, Rowan Davis, and Joby Davis, my children. I am a mother who has been blessed with the opportunity to raise 3 children. These 3 children are my life. They are what I treasure most in this world. And I, as unimportant as I may be, I am their voice, their protector, their guardian, their warrior. Like everyone else, their little lives were affected greatly by the COVID-19 pandemic, quarantine, and life as they knew it coming to a halt last year, not being able to see their friends, family, etc. I'm fearful of COVID, too. My husband and I have been vaccinated. We maintain proper hygiene and follow social distancing procedures. We wore masks when it was required and will continue to follow the rules as they are established. We have been lucky and blessed and careful to stay away from COVID-19 and have remained healthy throughout this time. However, we feel that it's important to stray away from a life living in fear. Take a moment to think back to your childhood and imagine how you were wearing a mask that might affect you. My kids miss their teachers' faces and experiences. And she said, I've heard the argument that says, just put a mask on your kid. What's the big deal? It is a big deal, and that argument doesn't work with me. I've heard other equally passionate discussions on the side with masks, and I've asked, a good friend who's probably not a good friend anymore. He and I have been arguing over this topic for about 2 weeks, and fairly passionate discussions. And the point I made to him was the fact that, look, today it's COVID-D. If we just get through COVID-D, then we'll be able to relax and there won't have to be any masks. And I said, well, what about COVID-Mu? Yeah. What about COVID, O and P, X, Y, and Z? Let's start over, AA. What about all these that are coming? What are we going to do? Today it's D, we'll get by that, we'll put on the mask again for Mu. It's not going to end. I think we're at a position now where it can be mitigated, and I think that mitigation can be through personal choice. We talked about local control at the beginning of the meeting, and I think I lost cell service. I do believe in local control, but I also believe, whether it's coming from the state or being mandated by a school board, that parents need to have the control and make the decision for themselves. If they want their children to wear a mask, I absolutely think that's perfect and fine, and that's their choice. And for those parents who don't want their children to wear a mask, I think that's fine as well. So I guess what I'm saying here is a tough choice, but I was elected by a majority of citizens last year. I thought the majority of citizens wanted the mask, and I voted that way. This year, I think the majority of the citizens do not want a mask, and I think local control should be at the parental level, and therefore I will not be supporting a mask mandate.
Okay, Julie, do you have anything to say?
I prefer to continue to listen for now, thank you.
Okay, anybody from the board? Ideas, thoughts, points?
I just had some questions that, based on discussions with people that were coming up, and I want to clarify before any motion is made. Sorry. Yep, I'll lean closer, Julie. So one is, last year before the school year started.
Directly into the microphone, so I cannot hear very clearly.
Sorry, I'll try to speak loudly. I'm practically swallowing the microphone at this point, but I'll do my best. So last year, before we started school, we knew we were likely starting with a mask mandate. We ordered tens of thousands of masks so that they could be provided to people who showed up without one. We of course didn't do that this year because this option wasn't even on the table at the time we were making the plan. So if we adopt a mask mandate, do we have masks on hand? Will families be able to find them in stores? I mean, it's a concern. So I was wondering, and also, if we have to purchase, what's the turnaround time, and would that be covered under our present ESSER fund budget? So.
Yes, please. Thank you. Thank you, Dr. Mariani. Yes. Can you hear me well? Do you need me to take my mask off? Okay. Thank you so much. Jeremy is saying that last year we were starting the school year with a mask mandate. That was the situation. Therefore, we were prepared with masks for our students and our personnel. But this year, because that wasn't even an option, we didn't have masks available or in a store, or how many masks do we have? And if we have to implement a mandate, will we be able to get the masks? What will be the turnaround? And Dr. Brianek is going to answer that question.
So I checked with operations and maintenance earlier today, and we have about 10,000 masks available to the buildings. They're in the warehouse, our school warehouse right now. And if we placed an order for more masks today, we would have the masks Monday, if not Friday. And the masks are in Sioux Falls that we would order them from.
So right now we have in our storage 10,000 masks. If we were to place an order today, we will have it by Friday? Friday or Monday at the latest. Our supplier is in Sioux Falls. That was the answer.
15,000 students.
Just one moment. Anything else?
Probably, but Taylor, do you have anything?
Yeah. One mask for the rest of the year?
Nothing
For the rest of the
I'm
year.
going to say.
Please,
You
gentlemen.
didn't say a single word while you guys were talking. Not a single word.
The time for your participation has ended. We need to have this discussion now and make a decision. We want to thank you for being with us, for informing us, but we need to proceed.
I have been pro-mask since March, right when it came out. They are correct that when we issued it the first time, we did not hear near the public pushback. I still believe wearing a mask isn't a personal choice, it's a respect choice. I respect the people around me, so I will wear a mask. On Stanford Medicine just released 2 weeks ago a groundbreaking international study showing the effects of wearing a mask. I know if my father went into a Stanford doctor and he heard a recommendation, I would not push back the Stanford Med, Yale Med, Harvard Med, Iowa Med, Creighton Med. However, I did have a phone call this morning, and that phone call was with some school nurses, with some school teachers, with some parents. While I believe that masks work, do they completely prevent COVID? But no, but the seatbelt you wore here doesn't completely prevent you from dying, and I'm sure you still wore it. So that argument doesn't work with me. The personal choice argument does not work for me. That has never been the stance on masks. The mask stance is you wear it to protect somebody else, not yourself. That's never worked with me, and you don't have to agree with me because I'm not the one saying it.
Once again, please.
Nothing that has been said in this room by people who have been disrespectful this whole time have switched my views. However, the phone call I did have this morning and last night and yesterday afternoon with our teachers, who I said I would run and sit up here and represent our staff. The SCEA came out and said they aren't going to take a stance. I probably talked to 55 teachers, whether texting, phone call, or email, and all but 5 would say they don't want it and they don't think it's going to work. And they are the ones that are there. I try to get to a school once a week, but obviously I'm not there near as much as them. So I think as of right now, I have to listen to our staff. I have to listen to our students. Even though I think not wearing a mask purely because you don't believe it works is not the way to go through life. We up here have never claimed to be experts. You have all made it seem like we are the ones saying this. Local health, state health, national health have said it. We are just echoing what they have recommended to us. So don't come up here and say that we are the scientists, we are the doctors, because we've never claimed to be. When I ran for school board, I didn't want to be a doctor. I didn't want to talk masks. This is not what we want to be doing. I think the decorum in this meeting has been unbelievably disrespectful. And it's really the reason why we are here today in the state of the country that we are in today, because we can't sit in this room and let someone who doesn't agree with what we're saying talk for more than 1 minute without shouting. And I'm a registered Republican, and I think it's been distasteful what we've done here in the last 2 hours. It's been disgusting. But at the end of the day, I have to vote for my staff and my teachers and my students who they don't want a mask right now. It pains me to do it because I personally believe it will help. I personally believe it will save lives, but I can't do it because the staff and teachers that elected me say no. So that's where I stand.
Once again, please. Do you have anything to say? Yes, Julie.
Of already having our minds made up before we came into the meeting. I had my mind made up before I got the string of emails, before I came into the meeting, before I got the multiple phone calls and text messages. I wear a mask. I'm asked to wear a mask at work. So for those of you who said, how would you like to wear one for 7 hours a day? Well, I do for 10 hours a day. I have many children in healthcare. They wear them on 12-hour shifts. But And I will say that my entire family, 27 of us, got COVID at my father's funeral last year. So, I am in support of masks, I'm in support of vaccines. But I, similar to Taylor, have heard the word from the parents and from the teachers. And I also, like Taylor, ran for the parents and for the students and for the teachers. I guess one thing I'd have to say is that the SBA does disappoint me that they've not made a stand one way or another, and that is because last year, for a full year, board members, we sat in the room and listened, meeting after meeting after meeting, to the complaints from the teachers about not being in the safe space, and yet now they're not making a statement about wearing masks. They're not wearing masks. They prefer not to wear masks. So I'm deeply disappointed that. I'm also disappointed with the sounds that I've heard. I'm not there in person. I'm driving to a meeting 3 hours away, but the sounds that I've heard through the last 2 hours. But I do want to support the parents of the students and of the faculty. And so for the time being, I will not support a mask mandate.
Do you have anything else?
Yes, some of have left, but I want to thank each and every one of you for your different avenues, those that are watching on stream website, those that are in person, your different avenues of communication to the board with your various perspectives regarding this topic of concern. Although I believe that some of the communication was highly disrespectful, distasteful, and totally unnecessary. Some of the comments made in here today, the same thing, totally disrespectful, totally unnecessary. I read each email, and I tried my best to respond to all. So if you didn't get a response from me, it was simply because I had to go to bed, and it was 11:30 at night, and I had worked all day and been up 4 o'clock that morning. That is how dedicated I am to this district. So you'll probably hear from me after this, because I'll respond to your email. That was my promise as an elected official, that I would respond to every email that I've gotten in my tenure. I will not go into a long speech because my perspective has not changed on why I believe that mask mandates are necessary. However, I will say that some of the emails from our community, again, were alarming. Were alarming, but it opened my eyes to what community I actually am existing in. And it's unfortunate because I was born and raised here. But our dynamics have changed, truly changed. And so with that, I would strongly suggest our community to put our feelings aside and see the facts for the safety of ourselves and our children. Remember, those that mocked coronavirus are 6 feet under at this point. That is not nice, and I've lost a lot of good friends and family and acquaintances. Personal attacks on this board, who spends countless hours of volunteer time, shows a lack of respect, and it really shows the level of some people's character. Bullying tactics don't work with me. I've had big bullies in my life. I've survived those, and I will continue to survive criticism. I love criticism if it's good feedback. Those that want to attack, we don't need that up here after countless hours that we donate. It is unbelievable of the political pressures that have played a part and still playing a part. I didn't run for school board for any political platform. I ran because I believe that our district has a lot of potential to grow in growth and development. The most precious commodity in our district, and I've heard my other board members, but I want to remind us, the most precious commodity in our district is our children. I have heard clear language over the emails and today of words like my, I, and mine. But what about them, those, and others? Again, it has been scientifically proven that wearing masks reduces the spread. It reduces it. Something is better than nothing. Last year, people in this room, my board members, we came together as a nation in the heart of the pandemic to follow the mask mandates. It's simple that we come together again for the same reason. And I heard someone say, is this permanent? No. This is a temporary situation until we can slow this spread down. We did it last year. What makes last year so different this year? The district has many challenges, and we have figured out how to come together and how to work through them. Do we always agree with the decisions or the votes? Absolutely not. But we are a board that makes the necessary adjustments to move forward as one district. So with that being said, and someone accused me, I heard my name earlier in this meeting, this is not a scarlet thing. This is because we have talked as a board behind closed doors and really tried to work together to see what is the best for our students. So with today, I would hope you would not suffer. I heard pot shots about unity in the community. That organization has done a lot of positive things in our city and will continue to do so. And that is an organization that works hard. It would be nice to see this type of energy put into our community and not a political agenda undermining the movement. So with that being said, to my colleagues, I respect your opinions and your stance. And again, regardless of what happens today, as your vice president, we're going to work together because it's okay to disagree. Thank you.
Thank you so much. One
question. Yeah, I'm going to try. I'm naturally pretty quiet, but one question that has bothered me as I've been thinking through this, reading everyone's input and trying to figure out, what the best path forward here is. And it's something that I think Ms. Scalaro touched on, and I think our first speaker, pardon me, I don't remember your name. I knew it ended in Pepper, it was hard to pronounce. That it's something that I've struggled with is, so last year, when we released our return to learn plan and we were moving along, we didn't have set benchmarks, but we all discussed about, well, when this positivity rate hits 15%, we need to start talking about if we need to do something different. unless I'm wrong, I don't think the state or the county tracks the same types of benchmarks anymore. Am I right on that? And so something that I've been struggling with, because I often try to go to the end and work backwards to kind of test the logic of a position. And one of the things I was struggling with is, okay, if a mask mandate were adopted, how does it end? Or to Ms. Colaro's question, if one is not adopted, how do you know that it is time to? And I can't answer that question. There's just no data available to us as a district, and so I've been struggling with that question, and that goes to the duration. So I don't what's out there to guide. Do we have anything more than what we have on our website?
Dr. Mariano, do you want to speak to that? Currently, the state has a rule that any building that hits a 10% illness rate, that we have to report that to the Department of Public Health.
Gotcha. And then the only way we know that, if we cross that 10% threshold, is if we're told.
Taylor, could you speak to your microphone again,
Sorry.
please?
The only reason we are aware of crossing that threshold of 10% is if the family of the positive case tells us, right? Is there any way for us to know?
Well, we're monitoring attendance rates, so it's not just a 10% COVID rate, it's 10% illness rate. So we're monitoring attendance every day in our buildings.
So that in theory, I mean, that if we were to reach a point where we were hitting 10% illness rates in many buildings, that might be the trigger point for the board to say, do we need to discuss something now? Okay.
Correct.
I just didn't know what measures were out there, because last year we talked a lot about numbers and a lot about measures, and then they all went away. And so, it was a big part of the discussion. Then suddenly we had nothing.
And now, for the record, that is what we've been trying to do since the beginning of this year, was to track that, and that was requested several times in our leadership meetings to bring it back to our agenda so we could have the data ongoing. And when we come to situations like this, we're not reacting, but we're proactive.
And we have been sharing all the data on the website. Everybody can go to the website, and the COVID numbers have been displayed there and updated there. Mr. Goodwell, Julie, do you need to say something?
Can you hear me?
Yes, go ahead.
This is Dan. And just at the beginning of the meeting, I had asked about the numbers, and the last number I had seen was from a student population. We had roughly 20 students that had been reported as positive COVID out of roughly 14,500 that are attending in person. Is that correct? And if I remember, it was somewhere around 9 staff out of roughly 15 to 1,600 staff. Is that correct?
That is correct for last week's report.
Okay. So the numbers are very, very, very low. And I do understand the absentee rate. People would be absent for a variety of number of reasons, including appendix being out, or COVID, or a variety of other illnesses, or absences unexcused. I guess that's something I think would be important for us to continue to track, is total absences and then COVID absences along, same for students and staff. I think that would be important, and would encourage parents whose students have tested positive to report into us. And to make sure I'm absolutely clear, the district health does not have an obligation to report positive student COVID results to us. Is that correct?
That is correct. That is correct.
Can they do it voluntarily, or are they prohibited from doing that at all?
They need parental. They're not prohibited, Mr. Greenwell. They're not engaging in
I'm sorry,
that.
I couldn't hear you.
They're not prohibited, to answer your question.
But they're not doing it anyhow. Julie, you have something to say?
Yeah, totally up with what Dan and Jeremy are saying. Could we agree on a benchmark that would play with the together and we can down the question of whether or not we can have mandate?
That was one.
No, I mean, I'm not for a mask mandate, but what I'm for is continuing to review the data to see maybe sometime else that it may or may not be warranted. I would not vote for a mask mandate today, based upon what I said earlier, but I'm always open for keeping the data updated, and we as a board and as a community updated on that, because at some point we may change our mind, and I'm not saying my mind's fixed forever. I think it's something we have to continuously review, and having best available information in my mind is something we should always continue to review. Today's answer may be different than a month from now or 3 months from now.
Correct.
Mr. Greenwell, I would only add to your numbers. Your numbers were a little bit low, and I'm not talking about the numbers of those reporting COVID. I'm talking about the total numbers. So the percentage is even lower. The number of students is above 14,800. The number of staff is above 2,400.
Okay.
And so, again, just wanted for absolute clarity.
No, I appreciate that. That means it's even very, 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 very low.
Thank you both. Julie, you were going to say something. I'm so sorry. We'll make sure to speak louder, closer to you.
Yeah, I guess, one of the reasons for the question is, as the discussion's been going on, I'm not sensing that a mask mandate is going to pass today. But, we had, last year, there were times like when we said, okay, if we hit this, we'll have the discussion. Because one thing I don't want to do is to do this to the community every week, right? It creates too much uncertainty for parents and for children. But at the same time, as Dan said, we have to continue to monitor. And so, I think to the extent that we can provide guidance to the community on that, I think it's going to be beneficial to everyone, because, and maybe we can't based on the data that's out there, but if we can, I would like to. That way, parents understand what may be coming and can prepare.
And can I say something, President? Because I know you're going to give the final remarks. I wanted to clarify something of why 3 o'clock was chosen. It was not to exclude any working person or people that have to pick up their families. Special meetings are just that. They can be called at any time as long as there's a 24-hour public notice. And this was to help those that you see on the screen or hear over the phone. It was to help them be a part of this meeting. So it was not to exclude anyone, for the record, because that has come up numerous times in the emails. So I wanted to clarify that. City Hall meets at 4 o'clock every day. And Bob Scott doesn't, I don't think, get this many complaints. And they meet at 4 o'clock on the Mondays that they meet. So it was not to exclude anyone.
My other thought is we have plenty of parents in the district that work the night shift. So they're never able to come to our 6 o'clock meetings. Most of us work during the day, so we have time in the afternoon. But, it wasn't with intention to exclude anybody. If we are done with your remarks, I think I need to express mine. And some of the things that I want to say, first of all, I am really, really, really surprised of how people know me so much better than I know myself. I am impressed how they know how I'm going to vote even before I say anything. So, I don't know if you have a crystal ball and you can see the future, or maybe we are, best friends forever. I work as an interpreter in court for 18 counties in Iowa and 14 counties in Nebraska. I'm constantly on the road. I'm constantly around vulnerable population. I'm constantly around different people. And one of the things that I started to notice as I travel across the state, or the states, I should say, is that in Iowa they decided, the judicial branch, to enforce again the masks or the face coverings in courtrooms. And in Nebraska, in several of the counties where I work, again, they started utilizing the masks, and there were some orders from judges telling us what we needed to do, again. So, that said, I began to get worried. If it is true that judges, attorneys, and those people that are in those courthouses are really important, it is also important the children that we have under our care, and that began to worry me. I reached out to the American Pediatric Association. You heard something said about that earlier. And once again, my biggest concern had to do with the smallest group, or little children. And I have here teachers that I respect dearly, people that have become part of my family because they were my kids as children. And we have known each other, and I respect them so much, and I trust them with my life. I trusted them with my children. And so, and they continue to be great friends. And I have friends that are in favor, and I have friends that are against. I have friends and family members that are immunocompromised. I have friends and family members that are healthy. Myself, I don't know, sometimes I'm doing well, sometimes who knows. Wearing the mask for me has to do, once again, that I move around vulnerable populations, so I never know if I caught something. And so it's more out of respect for the people that I'm around, even if I don't wear it correctly. Would you teach me how to wear it? I don't know who said that. Anyway, my point in this one is we are doing the best that we can. We're doing the best that we can. Why did I run? I never thought I was going to run for a situation like this. I never thought my vote had to do with the safety or the life of children. We're talking about 15,000 children. We're saying that those kids that are under 12 are my preschoolers to 5th grade mostly. There might be some 11-year-olds in 6th grade in middle school, but most of them is my elementary students in my early childhood education centers. Those kids I was worried about, and I was worried because we don't have a vaccination for them. So to be honest with you, we have talked about vaccines, and I have been talking to the American Pediatric Association and some pediatricians in town and across the state of Iowa, trying to get a better grasp of what are we dealing with. What would they recommend? They were recommending a mask mandate to protect the children. I know we think Fauci is crazy and the CDC is crazy, and everybody might be crazy. And I know that just like attorneys, ourselves, when we read the Bible, we understand different things from the Bible, right? So we all have our opinions and the way that we see things, but I was trying to get the opinions from the experts. So it wasn't a political decision on my end, but what was needed for our children. That was my only goal. And once again, we've been having this conversation since March when this thing started. So one of the things that I was considering, because we have now middle schoolers and high schoolers that have been vaccinated, as well as adults, the ones that have chosen to do so, I was considering, would it be wise to then have a mandate only on elementaries and early childhood? By your testimonies, I have heard what it means to you, and I understand the fact that not everybody is equal. We cannot use the same measures for all of the children. I understand all that. However, how do I protect about 7,000 to 7,500 of the children that we have under our care? That will be those in elementaries and early childhood. So that's what I had very heavy in my mind. And that was part of the reason of what are we going to do? I have heard you loud and clear. I feel like in a little island, even if we were to implement any sort of mandate, we have enough parents that won't do it. We have enough kids that won't do it. We have teachers that have very valid reasons why they won't do it. More than anything, we don't really have data provided by the health organizations to help us back up some of the things. The other thing that we can do is work together, and today we want to ask you to work with us. If your children are sick, please let us know. We have had instances where kids that are sick are dropped off in our schools, and we are not told. If your kid is sick, it's going to go to a care room. We have those care rooms working actively. Of course, if they didn't know they were sick, they got sick in the middle of the day, well, we can assume that at some point they got sick. But if within 10 minutes of arriving to school, they find themselves in the care room, it is very clear that the kid was sick from home, and he was brought to the school anyway. I can see that there is a 70% free and reduced lunch population that we have in our district. Therefore, most parents will need to go to work or will need to do something like that, and therefore, they cannot care for their kids. They don't have a babysitter. So the easiest thing, let's take them to school. But we need to be able to protect everybody. So we want you to partner with us and help us keep everybody safe by letting us know if your child is sick. And remind parents
if the kids are sick, to take the precautions necessary to keep everybody safe. I was thinking then, again, after talking to the Pediatrics Association, when is a vaccine going to be available? And they're really working really hard to have something available. They said November 1st. That's kind of the goal date that they have to launch the vaccine for 4-year-olds and up. They don't have for newborns or babies or preemies, but they do have it, or they're planning to release it for 4-year-olds and up. And so then I was playing with the idea, could we find a way to have a mandate until they are able to get immunized in the month of November? I heard you again. I'm just expressing to you my train of thoughts as we're having this conversation. So when you said you already had your mind made up, no, not really. I needed to hear from you. Again, I have dear friends and people that would like me to vote mandate. I have friends and family and people that would like me not to vote for that mandate. I heard you. I heard you. You teachers of little kids, and how important it is to see the facial expressions. Let me tell you that I've had the hardest time in my career as well, because I need to interpret simultaneously. So a lot of the things that I do is lip reading. And with the masks, I cannot hear, nor understand, nor read lips. And it's been a very challenging thing. So I know in a way what you're talking about. I know what you're saying. That said, we are coming to the end. I think that we have all said what we need to say. I just want to assure you of the school is doing everything that they can to keep data, to keep the numbers. But once again, the numbers that we have are the numbers that parents or families or students are reporting. It's self-reported. We no longer have the health department providing numbers for us or confirming numbers or medical offices letting us know in any way anything. But we're doing the best on that.
I'm going to ask again. While the health department is not mandated to give us numbers, has anybody reached out to them and asked if they would voluntarily give us the COVID numbers of students that are in the public schools?
There are lots of conversations with the health department in regards to many things, especially vaccinations and preventions, but there hasn't been an offer or yet a willingness to provide these numbers. It is a huge effort, and they don't have the human power to continue providing those things, especially if it is not a mandate.
Well, again, I would encourage parents whose children have COVID report that into the district so we could keep track of it internally ourselves and have the best information available in the future.
Thank you. So, anyhow, we continue to work on everything that we can. We continue to implement safety measures. There is a checklist that is a part of the things that we need to do. Still sanitizers and disinfectants and steel masks that are provided at request, I guess, if we needed to do something based on numbers. 10% would be the magic number? Is that what we're thinking?
That's what the Department of Health requires each school to report if they hit that 10% absent rate because of illness.
But we had that last year. I think establishing a percentage or a number that the board will or will not react to at this meeting, I don't think is appropriate. I think we need to have time to study last year's data, look at what the requirements are as part of a separate meeting discussion, not part of this discussion.
Correct.
I would strongly urge us from backing ourselves into a fixed, objective corner.
I understand that as well. Anyhow, so, Cindy, I'm so sorry, I think I'm having Alzheimer's or just the sleep deprivation. Did we make a motion about this item? Very well. We have had all this discussion. Can I entertain a motion then for that consideration or a mask mandate?
Yes, I move that all student, staff, visitors be mandated to wear a mask in the district buildings. This includes audience members of extracurricular activities and as participants in any meetings held within the district buildings.
Do I have a second? Okay. No second? Okay. So once again, this is a consideration of a max mandate. We can vote it yes or no, right? There is not a second. But Okay, so then what will be then? The consensus only, and we don't vote on it?
We don't vote on it.
Okay, perfect.
One last thing, one last thing. Director Scarlett, I commend you.
That's okay, I will sleep good at night, knowing I did the right thing. I stood on and didn't let politics push me into a corner.
I know you will. And the people who came here and respectfully voiced their opinion, I commend you. The people who didn't, I hope your kids don't see it, and I hope the kindergarten teacher back there, I guarantee you her students would have acted better in this room. Secondly, I hope they fuel my private jet the school board gave me right out front here. I will be there soon, so thank you.
Thank you to our medical experts, and thank you to our law enforcement for being here.
Before we finish, I just, one question that kind of came up in several comments that I wanted to make sure was at least somewhat addressed, was the question of medical waivers. If at some point in the future, because I guess from my perspective,
We have had them.
yeah, we've had those in the past, and I think we need to make it clear to anyone if this discussion comes up again that we can't adopt anything like in my mind, I can't entertain any motion that doesn't contain a very sharp carve out for medical. So I just wanted to make sure because that came up several times. So.
Yeah, we were pretty vocal on Monday about how a mask mandate would be respecting the health of certain kids. We also have to respect the health of kids who can't. So
exactly.
That would be a no-go for me if we get to the point where our district feels a mask mandate is the right thing to do. So, but once again, is for someone up here to go against what they believe because of what they've heard from their staff members on just how it goes. So it's unfortunate, but that's how it is.
That's life.
Yep.
It is life. Very well. Do I have then a motion to adjourn?
Yes.
Board members?
Move.
Second?
Second.
Okay, all those in favor say aye.
Aye.
Aye. Motion carries, and we are adjourned, 5:19 p.m. Thank you. Thank you, everybody.
It's called the 14th Amendment, they're all treated equally, that's the problem, equally. So no matter what you believe, everybody's trying to defend.
Good evening, good night.
Children the whole time.
Send us an email.
Oh, yeah, that's what you mean.
Yes.
Yes.